Welcome back. Let's get started and spread some kidney kindness. I am Osteopathic Mechanic and I'm here to help you feel empowered with anatomy knowledge and movement medicine. Today we'll go over the role of the kidney and what your role is as the operator of your kidneys, some anatomy of the container around the kidneys, and the contents or the neighbors within that container. We'll also look at what position your kidneys like to live in, how they like to move with breathing, and their full expression of vitality. The kidneys have 1 million nephrons, and these nephrons work to clean blood by removing waste products such as urea and excess fluid, which are then excreted as urine. The kidneys also help the body hold on to water whenever needed and also remove excess water when necessary. And this helps maintain a healthy balance of salts and minerals like sodium, calcium, phosphorus, and potassium. The kidney also helps produce renin and other hormones that regulate blood pressure and stimulate the production of red blood cells. And also, the kidneys remove excess acid from the body to keep the body's pH levels stable. And one of its coolest features, which I really appreciate for bone health, is that it converts vitamin D into its active form. So, this is really crucial for calcium absorption, and that's why it's also important for bone health. As the operator, your role is to keep your kidneys clean, safe, and bouncy. The kidneys are complex, hardworking structures, and they deserve your kindness. As the operator, you got to know these three things about your kidneys: where they live, how they move, and what keeps them vibrant. The left kidney hangs out around ribs 11, 10 or 11 on its superior surface, and the right kidney hangs out a little bit lower. If you remember from Love Your Liver, the liver is sitting on top of the right kidney, and that's why the position of the right kidney hovers a little bit lower than the left kidney. In relation to the spine, the kidneys live around T11 and L3. Anything below L3 is considered a low kidney, and that is an osteopathic emergency. I've set up this palpation exercise so you can learn how to feel your kidneys. So place both your hands on your waist like lobster claws and glide your hands up until you feel your 12th rib. So this sensation will go from squishy muscle to hard bone, and you might also have increased tenderness when you are on that lower rib. So now keep your thumbs where they are and rotate your hands until your pinkies are parallel to your spine. So now in this position, your fingers are pointing down. Stay there. Stay there, and as you breathe, you might sense a movement. These two bars of soap, one under each palm, gliding up and gliding down. Now we'll move from container to contents. The kidneys themselves are wrapped up in their own fascial sacs called the renal fascia. I like to think of them as soap on a rope. I don't know if you know what that is, but it's a soap connected to a rope. The soaps are your kidneys, and the rope are the pedicles that attach both of the kidneys, as well as the fascial threads above, below, and laterally. The renal fascia has anatomical connections on the back, the psoas muscles, which are the hip flexors, quadratus lumborum, or the QL muscle, which achieves trunk side bending and trunk stability. It also wraps around and will meet the transverse abdominis muscles, the lateral fascia that continue to the obliques and to the front of the abdominal wall. Inferiorly, the renal fascia will continue blending into fibers within the iliac fossa, inside the pelvic bowl, on the most lateral surface of the inner innominate bones. The right kidney is known as the mechanical kidney due to its intimate relationship with the liver. Remember, the liver is the commander and will boss its neighbors around. That also means the gallbladder will relate to the right kidney, and let's be mindful that the portal vein will be close by too. We'll also see interplay with the duodenum branching off of the stomach and the ascending colon meeting with the inferior portion of the kidney as it turns into the right colic flexure. Notice the large tubes, the blood vessels supplying the abdominal pelvic cavity and lower extremities. Say hello to the abdominal aorta and the inferior vena cava. Each kidney wears a little hat, an adrenal gland, and this anatomical connection between the kidney and adrenals is comprehensive to energy and fatigue levels. This includes the HPA axis as it relates to stress. In the container, the kidneys have muscular pillars, the psoas and the QL, and in the contents, the pillars are vesicles called the ureters. And so we can't speak of the kidneys without speaking of the bladder. These pillars hold true for the left kidney as well. The left kidney will wear a little hat too, the left adrenal gland, and it's very close to its neighbors, huddled up with the spleen, stomach, and majority of the pancreas. Neither are heavy onto the left kidney, unlike the right kidney and the liver, so that explains why the left kidney is positioned a little bit higher in relation to the left ribs. Like the right colon, it will be supported inferiorly by the left colic flexure on the proximal descending colon. So both colic flexures act as a scaffold or a dance floor for the kidneys. There is some literature that says the blood supply on the left kidney is anatomically related to the same blood supply to the left ovarian capsule. So between the left ovary and the pancreas, which is also a hormone organ, the left kidney is nicknamed the hormonal kidney. As an operator, you need to know the mobility of the kidney or the body rhythm of the kidney. And this one is really easy to remember. I find it really cool that the kidneys have an excursion about 3 centimeters up and down. That's a lot of movement that it's doing with each breath. Organs have their own body rhythm, performing natural self-healing cycles. One of the signs of disease is when these cycles are disturbed. Kidney mobility is easy to remember because it looks like how the diaphragm acts during breathing. So when the diaphragm contracts in inhalation, it massages the abdominal organs down. And when it relaxes during exhale, the abdominal organs get to float up. For the kidneys specifically, they will descend and externally rotate in relation to the pillars during inhalation. During exhalation, also relative to the pillars, they will ascend and internally rotate. So basically, the body rhythm of the kidneys is like our natural breathing patterns. So if we return to our palpation exercise, we can perceive that soap on a rope. As we're breathing in and exhaling out, we should feel a sliding down on either side of our spinal columns, as well as a gliding back up. One of the most important reasons why you, as the operator, pay so much attention to mobility is because without it, the innervation or signaling is impaired. The kidneys are online by the sympathetic nerves coming from the levels T10 to L2, and some literature supports that the parasympathetic innervation is coming from the vagus nerve. One of the tools that you have to be kind to your kidneys is the osteowiggle, which will liberate and mobilize each of these vertebrae. Ah, vitality. Without it, your kidneys would be dead. The kidneys have their own clock, a circadian rhythm, which is between 5 p.m. and 7 p.m. It's like happy hour for your kidneys. This is when they like to eat, drink, and play the most. Honestly, I think it makes a lot of sense. For the liver, a lot of the repair is happening overnight, but for the kidneys, you wouldn't want them to be super active at night. Otherwise, you'll just be making trips to the bathroom constantly. Some signs the kidney circadian clock is disrupted are difficulty rising in the morning, low energy during the day, low moods like feeling depressed, feeling more tired even after having caffeine, unexplained anxiety or feelings of fear, and back pain. And having a low vitality can mean that your kidneys are feeling sad. It will be hard to lose weight. You may experience insomnia. Jumpy legs are really common. Fatigue and weakness and nausea. Basically, when your kidneys are sad, it feels like you're coming down with something, like you have low immunity. There could be other mood changes that are more subtle, like confusion and pessimism. And a weirdly specific one is a metallic taste in your mouth. Remember from the role of the kidneys that its function is activating vitamin D. So essentially, if the kidney vitality is low, so will your vitamin D levels be. And that will manifest as translucent or pale teeth, skin, or dull hair, sometimes even hair loss. And happy kidneys are the life of the party. They are vibrant, lively, courageous. When your kidneys are happy, you are happy too. You're feeling more driven. It's really easy to feel more driven where you have that veil of fatigue removed. And your smile will look literally and figuratively much more brighter. And you'll have really good grip strength. When your kidneys are happy and functioning without impedance on their position, mobility, and or vitality, your muscles are literally stronger. So what are we going to do? How can we be more kind to our kidneys? So remember the diaphragm? It's on top of each kidney and it likes to massage the organs during breathing. This is why a deep, long exhale is a beautiful massage for your kidneys. The kidneys really like rebounding, jumping, dancing. It strengthens the pillars that support the kidney structure and help it flush out those toxic fluids. Cranberry juice is very kind for your kidneys, or specifically the natural derivative D-mannose. If you have a UTI, the vitality of your kidneys will be low as they'll be working extra hard to fight infections. Cranberry juice is one of those ways you can help flush out those toxins. I use this one every day. It's gentle percussions on your back. These little taps help loosen up your muscles and fascias around your kidneys. Basically, anything that you can do for your hip flexors in terms of strengthening and lengthening. I use marching, sometimes do marching with a resistance band. You can also hang your leg off the couch or hang one leg off of your bed when you're lying down. The psoas muscles or the hip flexors are the muscular pillars where the excursion of the kidneys are happening up and down. So hip flexor health is kidney health. And lastly, be courageous. Do the things that scare you. Feel the fear and then do it anyways, because that really helps boost the vitality of your kidneys. From Osteopathic Mechanic, spread the kindness, share with a friend. Thank you for listening to Kidney Kindness.